If you are a nursing student searching on how to pass clinical in your nursing program, then this video is for you. I am a clinical instructor and I have been evaluating students for years. I have failed students and I've also seen students become the nurse that they were destined to be. And the difference has absolutely nothing to do with their grades, but has everything to do with these tips that I'm going to be outlining in this video. If you don't know me, my name is Shanae and I'm a registered nurse, and I also work as a clinical instructor and nurse professor. And if you are a nursing student hoping and wishing and aiming to pass clinical this semester or your next rotation, then you are in the right place. So these are the things that nursing school does not explicitly tell you or teach you. However, from my experience, these are things that make the biggest difference in my nursing students or students' performance during clinical. The first tip sounds simple, but it goes way beyond just watching the clock. Showing up to clinical on time, 10 to 15 minutes before your start time, goes a long way. So this gives you time to look up your patient, their diagnosis, their history, create some sort of care plan before you start your day. It helps you mentally settle before the floor gets busy. You want to walk on the floor as if you belong there, not like you just sprinted from the parking lot onto the floor. However, it goes far beyond the clock. It goes far beyond the time. It's more about your attitude, and we want to see if you are ready to learn. We don't want you to just go through the motions or just show up because you have to, because you need to get these hours, right? It's about how you present yourself, your attitude, your behavior, and how you show up on the floor. Clinical instructors notice energy almost immediately, and that sets the tone for the entire semester. Show up ahead of time, and not only that, show up with a good attitude. The number one reason students fail their clinical, it's not because of their skills, it's usually because of their attitude, more specifically how they respond to feedback from the clinical instructor. I've evaluated students who perform generally well in clinical, meaning they can perform every skill. However, the moment that I give them feedback, they become defensive, they shut down, or they made excuses. And then I've also evaluated students where I, again, gave them feedback and they respond with, "Thank you, I'm going to work on that." And those students typically do better in clinical, or they pass their clinical. Here is why that is a problem. A student who is not able to receive feedback is a nurse that eventually stops growing, and that is a patient safety concern. As a clinical instructor, we are not just evaluating you on what you know, but how you are able to be safe and practice independently with your patients. And if you are not able to receive feedback, that is a safety concern, because that means you are not willing to grow. So going into your clinical placement, I want you to go in with the mindset of, my instructor is giving me information, they are not criticizing me, and this is information that I can use to grow. Every correction from your clinical instructor is information that you can use to develop, right? And what you should do is act on it immediately and receive it graciously. Okay, moving on to tip number 3. So there are two kinds of nursing students in clinical. So there's one that follows the clinical instructor around, asks questions every 5 minutes, very anxious. And then there's one that's completely quiet and doesn't say anything. Neither of those approaches work well. What does work is proactive, confident communication, and that goes a long way. And it does not have to be complicated at all. One way that you can approach your clinical instructor is, "Hey, I reviewed my patient. This is their diagnosis. This is my plan for the day. Is there anything that I should be aware of?" That one sentence tells your clinical instructor that you have a plan, you're prepared, and you're thinking ahead. This changes your clinical instructor's perspective, because now you're going from a student that is being watched to a student that is now being supported. That is two completely different perspectives. Throughout the day, you want to check in with your clinical instructor every so often to kind of update them on your plan so that we can continue to support you. And if something comes up, you want to consult them before you act, not after. So when you're asking questions, this is not a sign of weakness. However, acting before you ask questions is. Making mistakes as a student is almost inevitable. Every student makes mistakes. I made mistakes as students. I still make mistakes as a clinical instructor. It happens. but it's more so on how are we going to handle it when it does. So when a mistake happens, just own it and act on it immediately. And thank God it's happening as a student, because at this point, you don't really have a license. If something goes wrong, go directly to your clinical instructor, or you can go to the nurse that you are shadowing or is precepting you, but you need to go right away. When I hear a nursing student say, hey, I made a mistake, I made an error, what do I do? So from my perspective, I see accountability, and I also see someone that's prioritizing patient safety above their own conduct. Beautiful. That's amazing to me. As opposed to a student who tries to cover up their mistakes, hide their mistakes. With that type of student, I lose trust, and then I lose respect. I backpedal from supporting my student to now watching my student and probably micromanaging. So overall, you are allowed to make mistakes in clinical. You're going to make mistakes. However, you're not allowed to cover them. And don't kill your patient. Tip number 5, preparation. And I think this is where a lot of students either win or lose the shift. If you have access to your patient's history or patient's information ahead of your shift, meaning the night before, please, please, please leverage this. And here's exactly what you want to extract from this information. So obviously your patient, their name, date of birth, you want to know their primary diagnosis, why they're here. You want to know their medications, not just the names, but you want to know what these medications are for in relation to their primary diagnosis. Any relevant lab values. You also want to look up top 3 nursing priorities for someone with their condition. So being prepared helps you answer your clinical instructor's questions. It helps to prevent you from freezing. And it helps you feel a little bit more confident with the day. So preparation really helps students pass clinical, and this is completely within your control. So this is something that you want to do either the night before or just before you start your shift, which you would have to come in early for that, which relates to tip number 1. They all go together. Tip number 6. This might be my favorite tip because it's just so simple. When a clinical instructor is asking you a question and you do not know the answer, don't make it up. Please don't make it up. Don't guess. Just simply say, I don't know. I know the silence is uncomfortable sometimes. However, making things up is a dangerous habit that a nursing student can develop early on. And I would rather you tell me that you don't know than just to pull something out of midair. It's completely different than making an educated guess, where you're using critical thinking to break down your thought process. You're pulling knowledge from theory, and then you're coming up with an educated answer. That is completely different than just making something up because you just want to give me an answer. So what you can say is, I don't know. I'm going to look it up. I'm going to get more information before I give you an answer. That's just like music to my ears. Again, you are showing that you're proactive. You're showing that you are accountable, and you are being real with me. You don't know, but you're going to find out, and that is okay. So the last tip has everything to do with your behavior in clinical. Sometimes there could be downtime, and you don't want to be caught sitting doing nothing. So what you can do is look ahead, ask yourself, what does my patient need next? Or can I help another staff member on the unit? Or can I help a classmate with their patient assignment, right? You want to show your clinical instructor that you can think like a nurse, and you are not just completing tasks like a checklist. However, you're thinking ahead and you're being proactive. Another thing is coachability. So what you can do is ask your clinical instructor, is there anything you would like to see me work on before the end of the shift? This shows that you are self-aware. This shows that you're invested. This shows that you are accountable and you are willing to grow and you are motivated to learn. So these are the type of students that I don't mind giving a reference letter to, or a reference for a job, because looking back, I remember their intention, I remember their motivation, their accountability, the fact that they're self-aware, the fact that they want to invest in their nursing career and their journey, because it all leads to growth. And that could be you. Okay, so those are the 7 tips that I have to help nursing students pass clinical rotation after rotation, and this is coming from the perspective and experience of a clinical instructor. So like, comment, and subscribe if you want more nursing content, and let me know if this video has helped you. Bye.